Hi, my name is Dr. Ross Hauser. Welcome to the Hauser Neck Center here in Fort Myers, Florida. Today I just wanted to give an idea of the progression of gastrointestinal diseases that I see. Because often most of us would say, I got a little bit of upset stomach, or I got a little bit of bloating, or I got a little bit of nausea. So most people who have those symptoms who can't resolve it themselves, right, they'll get dietary changes. Maybe eventually they see a functional medicine doctor and they might find out they have leaky gut or SIBO, small intestinal bacterial overgrowth. So they'll do diet changes, they'll take some acidophilus or probiotic, and they'll do the whole infection route, like how to get rid of like the extra bacteria or funguses in the digestive tract. And then what happens though if the symptoms progress? So progression of symptoms or severity of symptoms as they get worse means, of course, that the underlying condition is getting worse. And when the underlying cause is from a problem in the neck, so obviously the emphasis of today is going to be how ligamentous cervical instability and dysstructure can cause the electrical supply to the stomach and the digestive tract to be hampered, to be inhibited. So the electrical supply to the stomach, to the sphincters, to the intestines, a lot of the intestines is via the vagus nerve, and the vagus nerve runs right in front of the cervical vertebrae. And when it decreases the space right in front of the top two vertebrae, that can cause stretch and compression onto the vagus nerve, causing conduction blocks. Conduction blocks are where the impulses of the vagus nerve are inhibited, but the vagus nerve itself is not damaged. In our office, we look at the size of the vagus nerves. So when we look at the size of the vagus nerve at the atlas, you often can't see the vagus nerve. It's under so much tension there, and that's what causes the damage. But we can see it in the mid-neck, and in the mid-neck, most of the people that I see with nausea, bloating, weight loss, the vagus nerves are about half the size that they should be. And again, this is a progressive disorder. And then when the electrical supply gets so bad to the stomach stops working normally. And when it stops working a lot, that's called gastroparesis or paralysis of the stomach. So I'll show you a scan of somebody with that. So this is the common thing that I would see. You probably maybe have seen this on another YouTube video or another video. But basically, most people who come to the Hauser Neck Center, they have a lot of symptoms. And often, one of the commoner symptoms that we see is bloating or nausea. Many of them have been through programs to try to help leaky gut, intestinal dysbiosis, or various food sensitivities. This morning, I saw a patient and I asked the patient, I said, tell me the main symptom that has improved a lot. And she said, Doc, I just don't have the anaphylaxis or severe allergic reactions anymore to things and food. So basically, she would have to be so careful with food. She'd eat like 10 foods, where now she can pretty much eat all the foods. So in other words, like even people on really restricted diets, like that's not normal. So like if somebody feels better on a really restricted diet, I mean, that part's good, but if they have an underlying ligamentous cervical instability or dysstructure condition, just realize that condition is a progressive condition. Okay, I put this on here just because oftentimes when somebody has stomach issues, they'll say they got terrible fatigue. And sometimes what you have to do is you have to admit that your brain's sick, like you have anxiety, you're getting a little depressed, you have head pressure, you have blurry vision, you have a myriad of symptoms. So I put this on here because for brain health, we have got to decrease the amount of work the brain does, right? When your whole body feels sick or you feel like you got food poisoning or something, one of the best things to do is just rest in bed. So it's like, how do we rest our brains? Well, 80% of what the brain does has to do with the information we give it by what we see. So 80% of the work is from the things you look at, and the brain has to process it and figure out what to do. So if you feel like you have brain fog or brain fatigue, my advice to you is significantly reduce what your brain sees. So it's mostly seeing stuff on the internet, social media. So I'm in the process, you should be in the process of decreasing your screen time. And Dr. Hauser did recently get a flip phone. So when I'm not at work, I'm going to try not to do the internet. I'm going to try not to be texting and emailing and just do that sort of stuff when I'm at work, like I'm at work today. And then my friends, if they really want to get in touch with me, they just got to call my flip phone number. Okay, gastroparesis symptoms. So gastro meaning stomach, paresis meaning paralysis. So when the stomach's not working quite right, you get gastroesophageal reflux disease, you can get a chronic cough. You can feel irritation right here. You get lack of appetite, feeling full. You can vomit undigested food, but you get a lot of bloating, a lot of bloating. So what starts out with slight bloating, you can get acid reflux, because you might say, well, why do I got acid reflux? Well, you got to realize if the stomach's not working, the food just sits there, right? Eventually it's just sitting there. It's going to irritate the stomach, then you get reflux. You get slight nausea, more nausea, the bloating, nausea, reflux gets worse, and then all of a sudden you're diagnosed with gastroparesis. So it's better to treat things right here. So if you have some slight bloating and you have clicking, popping in your neck, or your neck feels heavy, or you have other vagus nerve symptoms, consider getting an evaluation for ligamentous cervical instability and a breakdown of the cervical curve called cervical dysstructure. See, here's your vertebrae. See how the vagus nerve, it runs right along the anterior portion just in front of the cervical vertebrae, and the DNA of the vagus nerve. The vagus nerves, there's one on the right side, one on the left side. In our experience, it's mostly the right vagus nerve that's degenerated in people who have gastroparesis or severe digestive problems. If you've been diagnosed with SIBO, fungus infection in the digestive tract, leaky gut, there's a good chance that you have vagus nerve dysfunction or vagus nerve degeneration from neck problems. When you get a death of enough vagus nerve cells, the vagus nerve gets smaller, and that's what we see on ultrasound. So vagus nerve degeneration is vagus nerve cells died. A conduction block is where, because of stretch or compression on the nerve itself, some of the impulses are blocked. To give you an example. So I had a young female who was very hypermobile, and she was losing weight so drastically. She was only like, let's say, 125 pounds, then she was getting close to like 100 pounds, and it was like rapid weight loss, and she was staying in the hotel just behind here, and basically it was on a Friday, and I just didn't feel comfortable that she left the area until she wasn't losing so much rapid weights. I told her that. So basically, on our testing, we figured out what position she needed to be in laying down in the bed so the right vagus nerve was relaxed, right? So we did that, and then of course we had her not do all the things she was doing, you know, like looking at her cell phone and everything. And basically by Monday she was pooping, and the bloated feeling was decreased a lot, and the nausea was better, and she was already eating better, right? So basically it just took one weekend. Well, that's an easy case because it's just a conduction block. So basically by the subtle changes in her neck structure, the vagus nerve function improved, and then of course her stomach was better, and she did very, very well. She did end up, oh, I should say though, she did get some prolotherapy. The prolotherapy also by tightening back there probably helped some too. Now, once you get to vagus nerve degeneration, I mean, that takes a lot longer to get better because you got to get the pressure off of the vagus nerve, then the vagus nerve has to repair itself, and it can repair itself. I had a lady who lived in England who came here for 3 months. She had all these vagus nerve symptoms. She had palpitations, she had dizziness, she had constipation, she had basically gastroparesis. Yeah, she did have gastroparesis. And then her vagus nerves went from one of them went from 0.7 millimeters squared as a cross-sectional area to over 2 in 3 months. But she was here 3 months just to get treated at the office, and then of course we're right by beaches and everything, so it was like a 3-month holiday, if you will. So that was like one of the more dramatic cases that I had treated, and it shows that the vagus nerve very quickly, if you're all in and you can be in a non-stressful environment, right? The nerve in the body that calms you down, that helps you experience peace, the nerve that lowers your blood pressure, lowers your pulse. You know, you hug your dog, you hug your kid, you hug your spouse. You know, that feeling of love, that feeling of peace, that all occurs through the vagus nerve. So every time you experience stress, you call the vagus nerve to calm you down. So the point is, you can just constantly put yourself in stressful situations, or because of your job, financial stuff, kid stuff, health stuff, you're in a constant state of stress. That can also hurt the vagus nerve. So I just say to people, I mean, you got to have a pro-vagus lifestyle. Like I use the example of myself. Like I might have a day where I have 22 patients. You know, many of them need prolotherapy. Modern medicine, you know, I'm the doctor of last resort, so they haven't gotten help or a lot of help from modern medicine, so they still have these horrible symptoms. But people would be shocked as I go from room to room to room. I just don't have a lot of thoughts. You know, I've learned how to keep my mind at peace. My pulse rate, you know, around 60. You know, so part of it is, if you're in a really stressful situation, you have to learn, how do I get peacefulness in the stressful situation? So how I do it is, I really do work on my faith. You know, I work on that God is good, God loves me. I go to church, read my Bible, try to encourage people. And then people that are around me know I do what I can to make them smile. I have a lighthearted attitude, much like how a kid would be. I giggle a lot, and I try to make things funny. Then with Marion, I try to be outside a lot. Recently, I've gotten a flip phone, again, to decrease my internet time or cell phone time. So when I'm not working, I'm going to try to have my brain be at rest. Then I try not to have upsetting things upset me. Because most of the time when something upsets you, it's just that the opposite person just doesn't really understand. You know, and so in other words, love necessitates me being merciful to that person instead of being vengeful or bitter or angry. It's a much better way to live your life, smiling than frowning. It just is. It's much better. Smiling helps a person feel better and gives a better countenance of what God wants us to be on planet Earth. Like human beings were meant to help each other, right? Somebody could have the exact opposite political viewpoint of me, or the exact opposite viewpoint of me, but I can tell you for sure I could learn from them. Like, why do they have that viewpoint? And there's definitely been times where I've changed my viewpoint just from people that I've seen. Here, the vagus nerve innervates all the sphincters of the body. So if you've been told, like for instance, you have SIBO, well, SIBO could be because your ileocecal valve is incompetent, and that the bacteria in the colon are now going into your small intestine. or your esophageal sphincters aren't working right, so you got gastroesophageal reflux, or you've been told you have pyloric stenosis, like the pyloric valve isn't opening, or you have gallbladder disease, but you don't have massive stones. It's just like you got sludge in there, or the sphincter of Oddi that's supposed to open your gallbladder when you got it, when you eat a fatty food or fatty meal, and it's not, and you're like, oh my gosh, this is killing me. It can all be from the vagus nerve. The most significant case I ever been involved with was there was this girl where her pancreas was degenerating and she was in the hospital, and I got on the phone with the mother and we got her out of this position, which was smashing on her right vagus nerve, and then we had her with better posture, and right before the attending's eyes, like over the next few days, her pancreas function and liver function started to return. So this just shows the potential mechanisms by which ligamentous cervical instability can cause nausea. So, you know, nausea, if you've changed your food, you've done whatever you can for your lifestyle, you try to have peacefulness, and you still got terrible nausea, well, it's probably because of one of these mechanisms. Ligamentous cervical instability could cause jugular vein compression, which can put fluid pressure on the nausea center in the brainstem, giving you nausea. You can have cervicovagopathy or vagus nerve degeneration, basically leading to poor digestion, gastroparesis, decreased secretions from the stomach, so the food isn't absorbed. You can get leaky gut, food sensitivities, gaze instability, where what you see isn't coordinated with your neck and you get imbalances, dysautonomia, eustachian tube dysfunction, leading to nausea. And again, when the vagus nerve is damaged, basically food just stays in the stomach because the stomach's not making a chyme. That's what it's supposed to do, is the stomach acid is supposed to digest the food, especially like protein and stuff like that. So the food just sits there and you just feel nausea. It's kind of like having low-level food poisoning all the time. And then ultimately you're going to end up losing weight. Like I've had young people in their 20s come in with feeding tubes that don't need the feeding tubes now. Like we help young people get off of feeding tubes because we help restore the electricity to the stomach. And then, you know, the vagus nerve, it innervates a lot of different things. So the problem is when you get vagus nerve degeneration, it can affect the heart, get atrial fibrillation, tachycardia, postural orthostatic tachycardia syndrome, mast cell syndrome, degeneration of organs, asthma, allergies, leaky lung, immune dysregulation. So if you have any of these things, autoimmune disease, and you don't know the cause, consider that it may be related to the neck. And ultimately, if the vagus nerve doesn't innervate these things, you get degeneration of organs. So if you've been told, I have interstitial lung disease, I have restrictive lung disease, I have liver degeneration, like I have cirrhosis of the liver, my immune system, my spleen, something's wrong, and they don't know the cause. It could be from the vagus nerve being degenerated. And the vagus nerve has all different branches, and depending on what branch is affected, you can get all kinds of different symptoms. You can get lung symptoms, digestive symptoms, heart symptoms, pain, swallowing problems, ear fullness, imbalance. Perhaps the easiest way to document vagus nerve degeneration is simply looking at the vagus nerve under ultrasound, and you get the cross-sectional area. Now, when people first come in and they have digestive problems, when we look at the vagus nerve at the atlas, like way up here, you can't even see it. It's under so much stretch and compression, like it's invisible. However, in the mid-neck, around C4-5, you can do an ultrasound, and it sits usually between the carotid artery and the jugular vein. And then anyone viewing the vagus nerve there can tell that with different postures and position, the vagus nerve may be in the neutral position with extension is circular, but then when you do certain motions, it's getting stretched. Well, that stretch and compression is what leads to the vagus nerve degeneration, or it cross-sectional area being smaller. And then the good news of that is over time, as the cervical curve gets corrected with cervical curve correction exercises, putting the computer up, wearing prism glasses, strengthening the neck musculature, and the cervical vertebrae become stable with prolotherapy when ligamentous cervical instability is present. We actually see the vagus nerve cross-sectional areas improve, and this normally correlates with improvement of symptoms. So common vagopathy, we see more and more young females, they have anxiety, they have shortness of breath, they have gastroparesis. So that's actually a syndrome that you can read about on Google. But basically, I think these things aren't because the young female just has an anxious personality. I mean, that can be part of it. But the point is, females are way, way more loose jointed than males. Even just recently, I was doing some research, and it's unbelievable in the neck how loose jointed like 1-year-olds are, and 2-year-olds and 3-year-olds and young kids. So in other words, they have all this ligament laxity that in one sense protects them because they fall down and nothing happens. Well, part of it is they're so bendable. The problem is, for the first time in history, parents are letting them look at something that's completely addictive, which is their cell phone, right? So now the kid is like mesmerized for like 6 hours, 8 hours, and they're looking down with this humongous head with these really loose ligaments. So what ends up happening is the jugular veins get blocked, their brain doesn't develop normally, they got high brain pressure and all kinds of other things, or maybe even the vagus nerve gets injured, it affects the digestive tract, and you have all these problems with impulsivity. They don't want this food, they don't want that food. So, and again, I think in teenage girls and women who have this triad, I think just what you need to do is get a lateral neck x-ray, and if the kid seems to have clicking, popping, grinding, or neck pain, then of course you need a motion x-ray or motion scanning to see if they have instability. And again, if they have instability, the pyloric valve won't work right, the stomach doesn't work right, digestive tract, and they get all kinds of symptoms. And then in the office here, what we do is modified barium study. So when you drink something, it's supposed to be out of your stomach within 90 minutes. So look at this person at 90 minutes, there isn't one drop of the barium in any part of the digestive tract except the stomach. So this person has severe gastroparesis. What I tell people is, you're going to sleep a lot better if all the food's out of your stomach before you go to bed. So since it's normal to get all the food out of your stomach by 90 minutes, so my advice always is don't be eating anything or drinking anything within 90 minutes of going to bed. You're going to sleep a lot better, and you'll probably lose some weight. But anybody who has cervical vagopathy, the treatment is a vagus nerve, a pro-vagus lifestyle, which is peacefulness, which is joy. So every day try to do things that are joyful. Try to limit the amount of stressors that you get exposed to. And I'm shocked at how many people have self-induced stress. You know, they'll watch things that get them angry on the internet. They surround themselves with angry people. They have jobs that make them angry. You know, they have spouses that make them angry. They have kids that make them angry. And always remember, we can't stop the initial emotion of anger, but we can, as soon as we recognize it, we can then choose joy. So I'm going to tell you one quick story. So in Chicagoland, there was a famous priest by Father Ruki. You could research him, Father Ruki. He was an exorcist, got kicked out of the Catholic Church for his exorcism. That was a story that I was told. I probably saw him when he was in his 80s, and there was books written on him. So he let Tim, my good friend, and I have an audience with him. So we took communion with him. Then I got to hear him get calls from all over the globe, and he would be praying for these people, and that was fascinating. Then Tim and I had alone, we had like an hour with him, and we could ask him anything. So I asked Father Ruki, I said, you know, how do you do it? Like, you know, geez, he devoted his whole life to the church, then the church, you know, basically kicked him out. And he said, Ross, I'm telling you, I don't let, and this is how he put it, he looks me in the eye and he says, I don't let somebody go into my heart and steal my joy. You know, and for a long time, when we had the office in Chicagoland in Oak Park, I had that saying, you know, where I looked at it every day. I had it framed. It was like, don't let somebody go into your heart and steal your joy. If the internet's making you upset or somebody's making you upset, you just got to take a chill pill from it for a while, right? There's people like this week, I know I had one person, I said, and they were a new patient, I said, until the next visit, you can't talk about your illness. Because sometimes the person just gets engrossed in every single conversation they have is about their illness. I'm not negating that they don't have an illness, they have it. But you have got to, even in the midst of illnesses, and we have illnesses that are currently in my house, my parents' house, there's, you know, good friends, like there's just so many illnesses, right? We're just in the murk of illnesses. There's so much human illness. Well, we should do our part so we're not making ourselves ill by what we're watching on social media. I just call it like basically internet pollution or email pollution or texting pollution. You know, so the words I say should give me health. The things I see should give me health. The things I hear should give me health. How many of you listen to music and if you looked at the words, they're complaining, they're evil, they're bad? Like, is that really what in your free time you should be listening to? And then as it relates to human structure, we have got to use our muscles. You know, like we have got to use our muscles. When we look at a cell phone, we're not using our muscles. So we got to get our computers high. We got to stop looking down at cell phones. And then, you know, if you have instability, it should consider getting some prolotherapy to resolve the instability. So if we do these things, I believe that not only will our brain health be better, our vagus nerve health will be better, and ultimately the body's ability to digest food and assimilate food and have food give us health and disease will be optimized.